Chronic pain is something that many people deal with every single day. And if that's you, you already know it can impact every part of your life. But what if there's a way to manage it that you haven't tried yet? In today's episode, I'm joined by Michael O'Neill, who's helped people find unique, personalized paths to healing that go beyond the usual advice. Whether you're dealing with chronic pain yourself or know someone who is, you won't want to miss this insightful conversation, and that's coming up next here on Own Your Calendar. Welcome to Own Your Calendar, the go-to resource for online business owners, coaches, and course creators who want it all: a profitable business and the time and energy for yourself and the people and things you love most. I'm your host, Stephen Box, and I'm here to help you build the systems and habits that allow you to escape the chaos and start living life on your terms. Hey, welcome to another episode of Own Your Calendar, brought to you by Unshakable Habits. I am your host, Stephen Box, and today we're going to be talking about a topic that affects millions of people every day, and that is chronic pain. So if you have been searching for answers or feel like you're just managing your pain without any real relief, then today's episode is going to be for you. Joining me for the conversation today is Michael O'Neill, the founder of Reform Health and Performance in Birmingham, Alabama. What's interesting about Michael's story is the way he challenges the common advice we hear about managing pain. After dealing with his own chronic injuries from playing football, Michael discovered that the typical treatments, things like medications, injections, and everything else, weren't enough for him, right? Because sometimes those things don't actually work. And it's very easy when those things don't work to think the issue is with you. But Michael challenges this and asks the question, what if the system itself is what's broken? So today he's going to share the moment that shifted everything for him and how it led to a more holistic, empowering approach to health. So if you're ready to explore a new path to relief and finally reclaim your health, let's dive into our conversation with Michael O'Neill. Michael, thanks for being here today.
Glad to be here. Thanks for having me.
Yeah, so we talked about this idea of the person who is in chronic pain. It's really crippling for them. It's preventing them from doing a lot of the things that they want to do in life. But I will speak from personal experience here as someone who was really that person about 15 years ago before I lost my 80 pounds and really transformed my life. There's a lot of things that you don't realize that you're missing out on, right? It's only in hindsight that I was able to look back on things and go, oh man, I didn't realize how bad that was. So could you maybe just start us off here by speaking a little bit to what are some of the common things that you see people experiencing when they're dealing with this chronic pain?
Like you said, you don't realize what you're missing out on. Your health is your filter for reality. Certain options disappear from your radar when you get used to them not even being considerations. Example, if you are like I was when I was in high school and early college and you had debilitating back and hip pain, a car ride to the beach, I live about 4 hours from the beach, a car ride to the beach scared me. Oh my gosh, I have to sit in the passenger seat, even if I wasn't driving. Oh my gosh, I have to sit in the passenger seat for 4.5 hours. And in my brain, I'm planning, right, if I take this pillow, if I put my leg in this position this way for 30 minutes, and that's just so much energy. It's mental energy, and it's so much mental energy that leaks having to consider something when, if you don't have chronic low back pain, especially if you're 19 or 20 years old, and it's, hey, we're going to the beach for the weekend. All right, cool. I put down my video game or stop studying for my test and, hey, let's pack up, go to the beach. You don't think anything of it. But if you're in that state of chronic pain, as I said, the pain becomes the pain, the health, the lack of health in this case becomes your filter for reality. So now what is supposed to be an anticipatory drive of fun weekend at the beach is now, okay, how am I going to get through this 4 hours of torture when I have to be bound into a car without being able to do my stretching or my foam rolling? So yeah, 100% back pain. And then these examples are easy to come up with. If you are a grandparent, you might avoid picking up your grandchild. I have a 4-month-old son. So if one of my parents my parents are decently healthy, but if they weren't as healthy, then they might have to, oh man, I have to go up the stairs to see the baby. And maybe I'm going to see the baby one less time because I just can't make those 16 steps today. And as you said, those options end up becoming invisible to you, and you become blind to the quality of life that you are missing out on. So you have to reclaim that healthy filter for reality where you maximize your options.
Something that kind of stood out for me as you were talking about that too is I think most people anyways don't want to be a burden on anybody else, right?
Correct.
And I think a lot of times without even realizing it, you can start to become a burden on people because now all of a sudden the expectation is I can't climb the stairs, so you bring the baby to me. No, I can't make the 4-hour car ride, so why don't we do something different that doesn't require me to be in the car for 4 hours? And now you're asking other people to make sacrifices to accommodate you.
Yes. And that's not a fun place to be at all. Is if you become blind to the burden that you are becoming on other people, then people might begin disassociating from you and you don't even know why.
Yeah.
And they might not even know why. It could be subconscious to them. Oh man, he's such a killjoy. I don't really know why. But like, oh, his energy's low. He never wants to do anything. Maybe I never want to do anything because my back hurts. So you don't want to say that. So there's just a kind of a silent disassociation, and maybe neither party even knows why you fell apart. Or one party becomes resentful toward the other, all based on things that were not intended to create resentment. They were not born out of ill will, but it's just the design is the destiny. If you have someone who wants to be active and that person is associating with someone who does not want to be active, eventually those people will no longer associate with each other.
It's interesting where you finished that up at, because I was actually thinking about that is at some point maybe the person does become aware, or maybe they're always aware that, hey, I'm causing issues for other people, or these things are just too much trouble for me to worry about. And then you don't want to say anything because you don't want to be that person who's always complaining, always feels like you're trying to make everybody feel bad for you or whatever. And so a lot of people, they just keep it in and they just isolate themselves and they cut themselves off from other people. And that's not a good quality of life either.
It's also not good for the pain physically, because you and I know about like dopamine. And when you have those feel-good chemicals that are being released throughout your day, it actually helps with pain. Mm-hmm. If there is a large overlap between your emotional state and your physical state, and you can get with it for sure. And you some people are going to go down those rabbit holes deeper than others. But at a fundamental level, I think most people would agree that if you are in chronic pain, you are more likely to be chronically unhappy. And if you're chronically unhappy, you're more likely to be in chronic pain. So it becomes cyclical. The opposite is true. If you are happier in general, then you're less likely to be focused on, maybe if you really do have pain, it might not hurt you as much. And it's not that the issue itself, like the scar tissue went away if you do have some sort of old injury. It's just that your perception of it is different. Your body is not registering it because it is busy being happy. So that there's an interesting overlap between the positive emotions and positive or negative emotions and the pain experience or mitigating of pain experience. We all know this. People who have social lives live longer. Isolation leads to early death. And the healthier you are, the more likely you are to socialize with people. And then the more likely you are to socialize with people, the healthier you are. All this stuff becomes compounding in both directions. The rich get richer and the poor get poorer.
Yeah, it's interesting because when you talk about this idea of it's all in the way that we react to it, the way that we perceive it. And I think a great way to look at that too is trauma. There are people who have had very horrific things happen to them that have allowed it to completely just destroy them. And there's other people who have had the exact same trauma who have found some way to turn it into a positive. And so when we look at the fact that both of those extremes exist, that shows us that the way we view things, the attitude that we take toward them, can really have a huge difference on how our life plays out.
Right. You'll hear about studies done, and I don't know specifically, I couldn't cite them, but a large talking point you'll hear in our world is there are studies done on baseline levels of happiness, right? How self-reported satisfaction, we'll put it in those terms. How do people self-report their satisfaction? And like you said, you have people who have traumatic things happen to them. And for example, people who lose a limb, people who have an amputation. No one wants that to happen, but they are they're a large part of these studies that people do on the self-reported satisfaction. And after a handful of years, most of the people who go through that process of losing a limb end up self-reporting very similar, if not the same, baseline levels of self-satisfaction a handful of years after the event. The same goes for people who have something really good happen to them. We hear all the time about the lottery winners, and then most of them end up the same or worse off financially than they were before. But the same thing, you get this big boost in life, but then after a handful of years, your satisfaction regresses to the mean. The people who you start making more money, then you start spending more money. So your baseline is always relative to where you have been and then where you are now. And so your satisfaction, it's you put a positive spin on it, on a negative spin on it. Oh, it's all subjective. It's all subjective. Cool. That means you can make it as good as you want. You could also make it as bad as you want, but why make it bad when you could make it good? It really is subjective based on your perspective, based on how you frame or reframe things. So why, if it is subjective, if it is based on your perception, then why not adopt the most positive framing possible? Positive being the thing that creates a desirable outcome for you, that creates an outcome that is in your self-interest.
Yeah, and if anybody really wants to learn more about that, the term is the hedonic treadmill. If you have that term, it really dives into that whole concept. It's a term from psychology, but it actually describes that phenomenon of how positive or negative events can have this huge impact, but then our overall level of satisfaction always tends to come back to that normal level, regardless of whether it's a positive or negative event. And so if you're someone who always is looking on the bright side of things and you're taking that positive perspective, you have an opportunity to build momentum. But if you're someone who's always finding the problem in things or always feel like you need that next hit of dopamine, it becomes very easy to become dissatisfied with a lot of stuff. So one thing that I wanted to talk about with you here today, people who are dealing with chronic pain, they've been put into a system here. And that system is the medical profession or the health industry, or however you want to phrase it, right? And so this includes chiropractors, physios, personal trainers, doctors, even mental health professionals, right? You have all these different groups of people, and the communication between the groups is like so minimal, right? It's really non-existent. And this is why people are getting so much conflicting advice on how to move forward. And they end up, I think, a lot of times feeling so stuck. And you've had a lot of experience in different fields, and you have a unique perspective there. So first, could you just share a little bit about your background in terms of some of that experience? What gives you that insight?
When I was 11 years old, dating back my professional resume to age 11, when I was 11 years old, I got the starting job as the place kicker for my middle school football team. Or I guess this would have been 12 years old. Yeah, so 12 years. I think I started practicing when I was 11. I got the starting job when I was 12. And I fell in love with kicking footballs. That's all I did. I quit every other sport just to kick footballs. I wanted to get a college scholarship. Nothing I wanted more than to play football, play college football, be a good kicker, be a good punter. And in the process of that pursuit, I ended up injuring my hip and my back pretty badly in high school and got thrown into this reactive healthcare system. Here's a steroid injection, cortisone steroid, not like testosterone steroid. Here's the cortisone injection. Here's a nerve block injection. Here's some stretching. Here's some physical therapy, which I would call an insurance-based physical therapy, which I refer to those clinics as physical therapy mills, because they are based on the volume of patients that they see, not the value of care that they provide to those patients. So at 16, 17 years old, I got thrust into this massive industry of insurance-based healthcare, which it's common to understand now. More and more people are understanding the reactive healthcare-based system, whereas sick care, it is more reactive to the problems that have happened. It is not about preventing those problems or pursuing help. It is more reactive to the problems, and people always talk about masking the symptoms versus addressing the cause with pharmaceuticals, with even a lot of orthopedic surgeries that people come to learn that maybe that surgery was not necessary had I, whether from a preventative perspective, or maybe I could have prehabbed it and had a better outcome. And even as I'm talking through this, I'm jumping around, right? I'm talking about, well, I was an athlete, and then I saw a physical therapist, and I saw a neurosurgeon, and I saw an orthopedic surgeon. And all of these people, some of them gave me different answers, but some of them couldn't even give me an answer. Where I found an answer to my problem was actually through a massage therapist. And just like any profession, there are good doctors, there are bad doctors, there are good physical therapists, there are bad physical therapists, there are good accountants, there are bad accountants, attorneys, right? There are good massage therapists and there are bad massage therapists. And the one I encountered happened to be very high level, not just in the field of massage therapy, but in her understanding of the human body in general. She was able to get me to a place without any drugs or injections. She was able to get me to a place where I felt good enough to play college football, which was what I always dreamed of. Now, I was still in chronic pain, but she got me to where I could actually take the field again, whereas I had to miss a handful of games by my senior year. So that was a big sign to me, like, I saw the MDs, I saw the PTs, I saw all the people who are supposedly much smarter, much more educated, much more qualified than this massage therapist. And on paper, sure, maybe they have higher IQs, that's fine, but they didn't help me. Whereas my massage therapist did help me. So that was my first experience of what I call the forest. There's this massive forest of strength and conditioning and doctors and healthcare and physical therapists and surgery and pharmacists. And when you have an issue, where do you go first? People who have an issue fit one of two categories. Or I'll say people who have an issue and are seeking a solution. They're always going to the people who don't want any solution other than the pill. Hey, doc, give me a pill. Hey, doc, shoot me up, kill the pain. I don't work with those people. There's too big of a gap between the approach that I want to take and the approach those types of people are willing to take, that I really just, I've insulated myself from having to work with those types of people, and that's fine. But most people who are legitimately seeking a solution, I find that they are over-informationed and under-actioned. And they are under-actioned because they are over-informationed. It is that paralysis by analysis. It is, hey, I sprained my ankle in high school and it's bothering me for the past 12 years. And I listened to this 3.5-hour podcast where this PhD talked about some mice studies where if they injected a certain hormone into them, then the ligaments in their feet got a 0.7 more resiliency after 3.5 weeks Do you think that I should look into, and it's, you know what I just said there, that is so much information that has almost zero relationship to an actionable step that someone could take to. So how in this massive forest of information, how do you navigate the trees without getting too focused on one? How can you take the forest perspective when you need a big picture perspective, but then focus on a tree when you need to focus on a tree? How do you know when you might need to climb the physical therapy tree for a little while before reintegrating the strength and conditioning tree? How do you know if the chiropractor tree is right for you? And if you do need to climb the chiropractic tree, how do you select a chiropractor? Because there are a lot of them out there. If you go to a yoga class, hey, is yoga good for you? My response is, hey, ask a better question. That's not actually my response, but it's anything can be good or bad for you depending on the context, right? Depending on who you are, depending on the context, the proverbial "it depends" response. I, as a licensed massage therapist, as a personal trainer, as someone who has been chronically injured when he was younger, and as someone who bounced around from all these different professions. So whether I was either a patient of this profession or I was a provider in one of these professions, I have a pretty good understanding of more trees than most people do, and how those trees relate to one another. Getting back to what you first asked, or what you first said, that there's not a ton of clear communication among these different disparate disciplines or trees. Each professional, the physical therapist, the doctor, the massage therapist, the personal trainer, each professional is its own specialty or special tree. And each specialty, special tree is unto itself, and is often so focused with what I call in my book a face to bark view. I'm just face a tree, face to bark, and you can't see anything else. And that is the approach you take until it's not working, and then you just jump to the next tree. Okay, face to bark here, face to bark here, face to bark here. The type of people who have chronic pain are typically moving too little in general. The type of people who have acute pain are either moving too little in a particular way or moving way too much in a particular way. It's either overuse or underuse. Most people who are in chronic pain are typically suffering from general underuse. Now, that doesn't mean that they're not active. They could just be active in a very narrow way. So depending on the person, the "it depends" answer, I find that most people who have the chronic issues need to zoom out from any particular tree and take a more forest approach. And as you and I know, that's the front lines of that is personal training, or just get a gym membership, do something. And then, of course, so what program should I follow? If you really don't know, then that's where the value of coaching comes in. And that's what we do at my gym. We're a personal training gym. We're a small group personal training gym. And we take people who are either not doing enough and teach them exactly what they need to do without doing too much, or we take people who are doing way too much and we rein them back in and say, hey, you don't need 8 days a week in the gym. You can get all the outcomes that you want to be a healthy human being with 2 to 3 days in the gym a week. They're like, oh man, I thought I was supposed to be 7 days, 6 days, only one rest day. And you can, but if your program is organized very well, but most people aren't capable of organizing their program in a way that's not going to lead to burnout or injury. So there's a sigh of relief when I say, hey, you know what? I just want you to work out here 104 times a year. 104? Yeah, 2 days a week. That's it. Yeah. I write your program. I select the best bang for your buck exercises. We're going to cover full body every time you come in here, full body with some conditioning. If you want more, we can do a little more, but you don't need more. And most people are very relieved to hear that. Most general population, athletes and special, those are different cases, but we're working mostly with general population people who are seeking solutions and are over information and under action. So we like to cut through the noise, send the signals, and give them exactly what they need and nothing more, because most people don't have the time and energy for more than exactly what they need.
And that's where we're going to wrap up for part one of this conversation with Michael O'Neill. As you guys can see, Michael has an incredible ability to just cut through that noise and give people exactly what they need to move forward. No more, no less. But we've only scratched the surface on this conversation. In part two, we're diving even deeper into how chronic pain impacts your daily life, how to navigate the overwhelming information that's out there, and the steps you can take to find real, lasting relief. So you definitely do not want to miss that, so make sure that you tune in for part two of my interview with Michael O'Neill. Until then, this is Stephen Box reminding you, as always, that today is a great day to break free from the chaos and start living life on your terms.